Well, hello there. I'm Dr. Jim Collins. Thanks for coming back for more information. I'm glad to have you. I have a heavier topic today. It's suicide risk and bipolar disorder. Bipolar disorder is characterized by experiencing mood swings from manic highs to depressive lows. Manic highs involve periods of high energy, a reduced need for sleep, and sometimes even losing touch with reality. Depressive lows include low energy, poor motivation, and loss of interest. Depressive mood is many times associated, though, with risk for suicide, and that's why this has to be taken very seriously. Bipolar disorder affects between 1 to 5% of the U.S. population, has a chronic course, and is associated with premature mortality. One specific reason for a decrease in life expectancy among those with bipolar disorder is unfortunately suicide. This runs anywhere between 10 to 30% higher than in the general population. So people with bipolar disorder, 10 to 30% higher risk for suicide than general population. Around 20% of all people with bipolar disorder end their lives by suicide, and another 20 to 60%, which is very high, attempt it sometime in their lives. So these are frightening numbers. There are many risk factors that are associated with suicidal thoughts and actions, including the following: the person's clinical history, any previous suicide attempts, right after admission or discharge from a hospital, an early age at onset, being diagnosed with bipolar, say in your early teens, early years after the initial diagnosis, having other psychiatric or addictive issues or problems, rapid cyclings, the swings between the highs and the lows, and having a chronic depressed mood. Those are all risk factors. So previous suicide attempts and the period after being discharged are the most highly associated factors, risk factors for suicide among those with bipolar disorder. Suicide is less likely when an individual is in the manic or the euphoric state and is at a higher risk during periods of great depression. Other risk factors include duration of untreated illness, being male, because men use more lethal means of killing themselves. Females, on the other hand, have more frequent attempts but less lethal means. Being divorced, single, or a single parent living in isolation can be a risk. Age is also associated. And those under 35 and over 75 are at the greatest risk for self-harm. Other risks include problems at work, being physically or sexually abused, and financial problems all raise the risk. A family history of suicide and major depression puts an individual at even a higher risk for suicide. Bipolar disorder is serious. It's a severe mental health condition affecting roughly 3 million Americans annually. It's marked by manic highs and depressive lows during which risk for suicide is heightened. While there are many risk factors associated with suicide, depressed mood, being admitted or discharged from the hospital, and a family history are key factors that should be examined each time the individual is seen in a mental health setting or by their family physician. So there you have it: suicide risk and bipolar disorder. Very serious topics. I'm Dr. Jim, and thank you for spending some time with me.